Good morning, good afternoon, good evening. Today it is October 29. It is today World Stroke Day. Acute ischemic stroke or large vessel occlusion is one of the main root causes of death in the world. Did you know that 1 out of 6 people in their life will suffer from stroke? More than 1.6 million people in Europe, Middle East and Africa will get a stroke every year. It's the second cause of death and long-term disability under adults in our life. Every 20 seconds, someone in this earth gets a stroke. We as Medtronic, as a neurovascular division, we are committed to improve the patient pathway of the stroke patients. Not only looking at our fantastic devices, what we have, but looking more broader and looking to the whole patient pathway. And what does that mean? I will tell you in the following 3 sentences. First of all, it is looking at the full systems of care, how you can increase the patient pathway. From diagnosis of a stroke to a treatment, and basically connect the hub and the spokes together so the patients will receive the right treatment in the right place in the right time. Secondly, with our clinical and proven portfolio in neurovascular, we offer the best-in-class solutions in the cath lab for our patients. Last but not least, thirdly, is we also, the stroke when it occurs and the patient pathway and get the treatment is important, but more even important is the post-stroke treatment. And with our solutions in cardiovascular group, with Reveal Link to basically prevent the patient from a second stroke, but also after the stroke, you can have post-stroke spasticity. And with our pump therapy, we offer a solution over there as well. Those solutions with looking at the full patient pathway is very much aligned with our Medtronic mission, alleviate pain, restore health and extend life. I would like to encourage to spend 2 minutes to watch the video further and spend time with your family, your colleagues and your friends to discuss the solutions and the indication of a stroke patient and what solution we may offer for those patients. Thanks a lot for your attention and I wish you a nice day. Thank you.
Is the patient breathing?
Yeah, he's just collapsed.
What do you mean by collapsed?
Well, I wasn't actually moving, I just stood, and then I went in and he's been on the floor, lying on the floor.
Is he conscious?
Yeah, he's conscious, but he can't, his speech is all slurred.
Okay, well
If someone suddenly had trouble speaking, suddenly felt weak, suddenly became visually impaired, would you know what was happening? A stroke can happen to anyone at any time, starting from just a headache. When an injury to the left side of the brain occurs, this can cause a paralyzed right side, speech and language deficits, a slow and cautious behavioral style, and loss of memory. If it happens to the right side, a paralyzed left side, spatial and perceptual deficit, a quick and impulsive behavioral style, and memory deficits. Ischemic stroke occurs as a result of the blockage of the blood flow in the brain. Ischemic stroke accounts for 87% of the stroke population. Approximately 30 to 50% of ischemic strokes are considered large vessel strokes. According to Stacey Pugh, for each 30 minutes of delay in the time to get a vessel open, from the time they first started having the stroke, there is a 10% lower likelihood that they will have a good neurological outcome after their stroke. The average number of neurons in the human forebrain is 22 billion. In patients experiencing a typical large vessel acute ischemic stroke, 120 million neurons, 830 billion synapses, and 714 kilometers of myelinated fibers are lost each hour. 1 in 6 people in the world will suffer a stroke in their lifetime. Medtronic is committed to supporting patients throughout the care pathway. We call it our care continuum. It is our process from the point a patient is having an ischemic stroke all the way to the point of recovery and rehabilitation. It is our commitment to lead in stroke care, creating key partnerships, supporting patients and the healthcare community with best-in-class stroke solutions every step of the way. The patient has symptom onset. The emergency services are contacted and the patient is taken to the hospital, ready to be treated. Rapid neuroimaging software identifies patients suitable for a thrombectomy. It is the most advanced and complete imaging platform. The patient is diagnosed with having a stroke. As a proud sponsor of the Angels Initiative, Medtronic is genuinely committed to their mission of increasing the number of patients treated in stroke-ready hospitals and to optimize quality of treatment in all existing stroke centers. We are helping to build a global community of stroke centers and stroke-ready hospitals, working every day to improve the quality of treatment for every stroke patient. The patient is treated via thrombectomy with our AIS portfolio, the most comprehensive, clinically proven portfolio of devices and sizes, providing greater choice and selection for all AIS approaches. After a patient receives therapy treatment, they'll be monitored closely and set an appropriate post-stroke care plan. Reveal Link is an insertable cardiac monitoring system. It diagnoses atrial fibrillation using a proven AF detection algorithm. Synchromed 2 is a programmable infusion system for precise drug delivery for chronic therapy for severe spasticity. Once the patient is ready, they will be sent home, ready for rehabilitation and recovery. Medtronic is committed to lead in stroke care, creating key partnerships, supporting patients and the healthcare community with the best-in-class stroke solutions every step of the way. We continue to strive to get patients to the right center of care as quickly as possible. Meaningful innovation, creative collaboration, efficient, connected care.